Thank you very much. And on behalf of our regional director, Susanna Jakob, she would have liked to have been here today, but unfortunately she could not. So I'm delighted to be able to step in to her and deliver her presentation. And particularly at this important moment on this important topic. And if I could have my presentation up. Otherwise, there we go. Thank you. Next slide, please. So, now the cartoon is obviously in jest, but it does illustrate some of the important issues that we're looking at and the need to ensure appropriate high-level access to quality healthcare services for all of them that need them. Thank you. Delivered in a sustainable and affordable manner. And this is exactly what the work of the WHO European Office on Universal Health Coverage and Health 2020 in general is all about. Okay, I'm going to wait for the technology to catch up. There we go. Thank you. So, my presentation today is divided into 3 parts. I'm going to give some of the context to the work on universal health coverage in the European region. I'll look at some of the challenges that we're facing to achieve European universal health coverage, and then some next steps and the way forward. I mentioned this very briefly yesterday, but just as a quick reminder for those of you who were not here, Health 2020 is the overarching health policy and strategy for the European region. It was adopted by all 53 member states, and it's a commitment that spans from 2012 to deliver on the 4 common policy priorities for health, which we have up there on the slide, and specifically the 3rd one, which I'm going to be talking about in detail today. So strengthening health, people-centered health systems and emergency preparedness, surveillance and response, and increasing public health capacities. And as I mentioned yesterday also, there are 2 strategic objectives which are key to delivering the 4 priorities. The first is tackling inequities in our region, and the second is improving leadership and participatory governance for health. And before I move on to universal health coverage, it's important to put this in the context of the Sustainable Development Goals. Now, many of you will be familiar with the Millennium Development Goals that ran until 2015, and the Sustainable Development Agenda has been put together within the framework of the UN under the leadership there to take forward not only the work that had been undertaken within the Millennium Development Goals, but to move this into a sustainable development agenda for all member states, for all countries in the global context. And the Open Working Group completed its work on the 19th of July this year. In total, there are 17 goals, which includes 169 targets. And goal 3 up here is the health goal, ensuring healthy lives and promoting well-being for all at all ages. And this is the basis for integrating sustainable development. And it's not only does it take the work that has happened on the Millennium Development Goals, the Health Millennium Development Goals, but it also sets targets for injuries, for non-communicable diseases, for the broader determinants of health, and importantly for our conversation today, universal health coverage. And this target, which includes the target specifically on universal health coverage, promotes the opportunity to both monitor and promote an integrated health agenda. And equity is very hardwired into the Sustainable Development Goal and into universal health coverage in general. And another point to note is that the country specificity of these goals is very important, and that's going to be very important in taking the work on universal health coverage forward in the European region. And just a very quick point on the link between health and the other sustainable development goals. And we have a very strong health goal in goal 3, but of course, health is relevant in many other areas, whether it's ending poverty, ensuring inclusive and equitable education, gender equality, peace and inclusive societies, ending hunger, ensuring availability of water. And these are very important for us to be able to deliver on the right to health. And there are others. There's Goal 11 on cities, there's Goal 13 on climate change and inequality. So the Sustainable Development Agenda is a very important one for health. And Advocating for upstream approaches to address the determinants of health is going to be an important part of it. High-level leadership in our countries is going to be necessary in order to achieve it. And with the intersectoral mechanisms that we're proposing, we're hoping to have some significant progress in the next 5 years. And this links very well to Health 2020. So in the European region, Health 2020 informed the Sustainable Development Agenda. And again, I'm going to come back on inequalities and improving health and well-being in general. Because, as I said yesterday, if we don't address this, then we are missing a trick. Inequalities, slow economic development are part of a vicious cycle. The current burden in countries is approximately 10%, so we cannot afford to ignore it. And in order to do it, we need to address all of the determinants of health. We do a lot already on lifestyle, particularly on tobacco, more on food, not so much on alcohol as we heard yesterday. We do a lot on environment and health, but we need to do more on inequities. We need to do more on social determinants, and we need to strengthen the sustainable development and the health agenda, because without health, we will not have the sustainable developments that we're aiming for. And again, we need a government policy at national level, at the highest level, which can respond to this with a whole-of-government approach. So moving on to universal health coverage. So the discussion on universal health coverage is not happening in a vacuum. It's happening in the broader context of inequity, of sustainable development, and of the role and the positioning of health in these broader governmental discussions. And we had a question yesterday about what is universal health coverage. I think this was from our colleague here. And put simply, universal health coverage is when everybody can receive the health services they need of sufficient quality without suffering financial hardship in order to pay for them. So there are two aims for universal health coverage: improving health by ensuring people get the good quality services they need, and through good health, improved economic development. And second of all, providing financial protection and therefore improving economic outcomes by protecting people against poverty. And it's important in this context to bear in mind what universal health coverage is not. Universal health coverage is not just about health financing. It covers all components of the health system: health service delivery, health workforce, health facilities or communications network, health technology, information systems, governance and legislation. It's also not only about guaranteeing a minimum package of health services, which again was the discussion yesterday, but also about a progressive expansion of coverage of health services and financial risk protection as more resources become available. And thirdly, universal health coverage does not mean free coverage for all possible health interventions, regardless of the cost, as no country can provide all services free of charge on a sustainable basis. In fact, universal health coverage is more than just health. Taking steps towards universal health coverage means taking steps towards equity, taking steps towards development priorities, social inclusion and cohesion. And this is a crucial concept with immediate consequences for all of the countries in the region, even if it is in different ways. And it's key to the implementation of Health 2020. And equity is at the heart of the concept of universal health coverage, not only in services according to need, but also in terms of financial protection against the cost of ill health. So, moving on to challenges and achievements. One challenge for universal health coverage is reducing unmet need. So removing barriers to access of services. And as we can see from the slide here, this is one of the key issues that we face, ensuring that people are not hampered from receiving the medical and health services they need due to their inability to pay. We can see considerable differences and inequities between countries on this scale. And a second challenge is the high levels of out-of-pocket payments, which again I mentioned briefly yesterday. And we're seeing a high level of countries, of households that experience catastrophic and impoverishing medical expenditure, which has been exacerbated by the financial crisis. And out-of-pocket expenditure, out-of-pocket payments, or OOPs, are the main cause of this. And this slide is produced from estimates that we have from WHO Geneva from a few years ago, and we're looking we're in the process of updating this for countries at the moment. But what we can see, nevertheless, is that out-of-pocket payments for medicines and health technology is increasing, particularly in Central Europe. And we know that out-of-pocket expenditure, when it's more than, I've gone too far, when it's more than 15% of the total, this is where we start to see incidents of catastrophic levels of health expenditure by households. So keeping below 15% of total household, keeping below 15% of out-of-pocket expenditure is an ambitious target for many member states, but it's necessary. And in moving towards universal health coverage, we need to prioritize narrowing the gap between health needs and utilization, improving quality of care, ensuring financial protection, and enhancing equity through both identifying and protecting vulnerable and marginalized groups. And as we can see from spending patterns during the height of the economic crisis, public expenditure to prevention and public health suffered a dramatic loss. And these are the patterns that we need to address. So in that vein, I think many of you are aware of the work that the WHO and our partners, including the Observatory, have been undertaking the economic crisis and policy responses. So I'm not going to go into that in too much detail. So the way forward. We're in the process of finalizing 2 documents for the Regional Committee in September, which is happening in Vilnius. First of all, the final report on the Tallinn Charter and the resolution on health system strengthening priorities for the period 2015-2020. And both of these have had direct input and collaboration with the member states. This slide here captures the process, and it comprises of 3 elements. The first one being oversight and steering, and in particular, there's been a core group of member states, Estonia, Belgium, France, Kazakhstan, the UK, Norway, Slovenia, and Germany, and external experts and WHO Europe staff that have been involved. The second, in development, there was a scope of the relevant material, including the reporting and documentation. There was a survey of the member state activity and a critical review crossing progress against the commitments. And finally, the consultation. So the paper has been reviewed and validated by our country offices, the external experts, and in a web-based public consultation. And in terms of directly addressing the member state requirements to inform our work on health system strengthening for universal health coverage, the 2 consultations we held have generated a broad number of priorities across countries, and many of these are categorized in this slide. For some countries in the European Office, we have already made significant progress, but for others, we still remain committed to taking them forward together. And I mentioned this yesterday, in grouping these priorities together into actionable areas of work, we have 2 priority directions which are transferring the delivery of services and moving towards universal health coverage, particularly in respect of reducing impoverishing out-of-pocket payments. And in addition to that, 3 cross-cutting factors have been identified: enabling a competent health workforce, innovation and access around medicines and health technology, and boosting health information. All of those themes have been a main part of the discussion over the last 2 days. And managing change and innovation is a key component for governing this process, and each works in a cross-cutting way, both across and within the strategic directions. So just to stress, as noted earlier, when we're talking about out-of-pocket expenditure as more than 15% of the total, the incidence of catastrophic levels of health expenditure by household start to increase sharply. So this is the first threshold here, as we can see by the yellow line. And countries with more than 30% of out-of-pocket expenditure, so the red line that we can see here, are very likely to have high incidence of catastrophic and impoverishing health expenditures. And we're trying to address some of these issues at the moment through a report on financial protection where we're aiming to have a regional overview by 2015 and 2020. And a final note. We have been increasing our work on non-communicable diseases, which are creating a particular challenge for our health systems. And the NCD health system strengthening work has allowed us to identify a number of important obstacles which we are working to address in all settings as they're appropriate. And as you can see, we have tried to group them according to their themes, whether it's service delivery, workforce, information, products, vaccines and technology, financing, and leadership and governance. And these 15 features, they encompass a wide range of features, from political commitment through models of care to managing change. These were developed in discussion with the member states, with policymakers, academicians, experts through a number of rounds of discussion and consultation. And they represent areas in which we can strengthen or better target our efforts in working directly with countries. So thank you very much.